We are talking about the different respiratory volume and capacities. You have to understand that you run a hospital and you are the head of the department. Okay. And you are pulmonologist, lung specialist, pulmonologist. This pulmonologist manage the respiratory like patient who have respiratory issue. Now, before managing this hospital, you should know how many cylinder you need to carry in case of emergency like corona period. And for that, you need to carry ki if person have normal breathing, how many cylinder do you need for the oxygen? And if there is a labor breathing like forceful breathing, how many you need to do? So first come up with the tidal volume. Normal volume inspired or expired during the normal breathing, like you are sleeping or you are reading. How much volume is inspired or expired during the normal breathing is the tidal volume. And during this normal breathing, amount is approximately 500 ml per breath. You know, we breathe 12 to 16 times in a minute. So if you want to understand how many, like how much oxygen is required in a minute, then if you take 12, it will be around 6 liter, or if you take 16, it will be 8 liter. 6 to 8 liter oxygen is required in 1 minute. If patient still, let's take for the 10 hour in hospital, so you need almost 60 to 80 liter uh, oxygen for one patient. And example, if you carry 100 bed, you need to carry for all the patient because you never know what can be the situation. Second, if you talk about the inspiratory reserve volume, if person is having labor breathing extra, and remember when we are talking about the inspiratory reserve volume, forcefully how much we inspire, forcefully how much we inspire. So forcefully should be more, around 2.5 to 3 liter per breathe, forcefully, forceful inspiration. Okay. Expiratory reserve volume, as name suggests, forcefully how much you expire, you exhale, how much you inhale forcefully, and how much you exhale forcefully. Then you know, if you breathe in, you breathe for more time when you inhale, and when you exhale, you breathe out for less time. You can do it, you can perform the same experiment. Correct? So that's why you can say ki it is around 1 liter. In reality, it is 1 to 1.1 liter, but you can consider almost 1 liter per breath. And you can feel it. Example, normal breathing, normal you breathe, forcefully you breathe in, forcefully you breathe out. Time you can correlate. Ki forcefully you breathe in, you breathe in for more time and you breathe out for less time. Correct? Even after forceful breathe out, some amount of air will be in the lung, and as name suggests, residual volume. Residual means remaining volume of air in lung after forceful expiration, which is around 1.1 to 1.2 liter. Okay, so these are the four basic things you need to know if you are main head of the hospital and you are managing everything. Correct. Based on this, we use different practical volume. This portion was theoretical. Ki we use these four things to understand what we need in the hospital. First application of this thing is the inspiratory capacity. Remember, capacity is the practical part. Volumes are the basic part, which is utilized for the capacity. Example, inspiratory capacity. As name suggests, maximum how you can breathe in after normal breathe out. Inspiratory, how forcefully you can breathe in. You can take in tidal volume plus you can take in inspiratory reserve volume after normal breathe out. After normal expiration or breathe out. Okay, after normal breathe out. It, and you can perform all these things. Ki, uh, turn on your camera, guys.
One second, sir.
Hmm. So, if you normally breathe in, you know here we are including less volume. Second, if we forcefully breathe in, so we inhale more air. We can't give number, but at least we can correlate. When we breathe out, see, you breathe in, but when you breathe out, it take less time. And even after forceful breathe out, whatever remain in the lung tell us what is the storage capacity of our lung. By using these four volume, you will first include inspiratory capacity. You normally breathe out and then you breathe in. What is the rule? When you normally breathe out, you are throwing away 500 ml. When you forcefully breathe in, what will happen? This 500 will definitely come back along with the inspiratory reserve volume. Make sense? Same way, when you talk about expiratory capacity, you normally breathe in and then so whatever you took in 500 ml of oxygen, you will exhale it out plus forceful. So these two look easy: inspiratory capacity and expiratory capacity. Inspiratory capacity, forceful inspiration plus tidal volume. Expiratory capacity, forceful exhalation plus tidal volume. Understood? Third, you have functional residual capacity. Functional residual capacity, if you normally breathe out, what you removed 500 ml of tidal volume. What will remain in the lung? Functional residual capacity. Capacity of your lung. It means volume of air remain in the lung after normal expiration. What remain, like what stay back? Residual volume is definitely there. If no residual volume means person is dead. As simple as that. It is always present. So functional residual capacity is there, in which we include respiratory volume, sorry, residual volume. We include residual volume and ERV.
So,
Correct?
so
Why?
the residual volume is lesser than the functional residual volume.
No. Yeah, definitely, because in functional residual volume you have two things: ERV
ERV and
plus
RV.
RV. Huh.
So
So
then for a dead person, he'll not have functional
you will
residual
not have
volume.
anything. That person will remove all the gas.
So, but then they spoke about incomplete cartilaginous rings and all that. That's what I was asking.
No, that manage the breathing
That'll collapse also.
before death. Before death.
Okay.
After death, there is nothing, na? Because there is no movement, no
Complete
ATP.
collapse. Okay.
Yeah. Okay. So remember, when we are talking about very particular, these last three are more important. And I think you get confused in last three. First, functional,
So my warden is calling me, 1 second.
sure, sure. Functional residual volume, capacity. So residual means residual volume will be definitely there. And when you are normally breathing out, you are not exhaling out ERV. You are not. So what remain in the lung? ERV, because that you are not exhaling out, plus RV, always there. Any doubt, Chandana,
No, sir.
Jordan?
No, sir, got it.
Next is vital capacity. Vital capacity is something that you can check your lung. How ki, how much air you can take in when you forcefully breathe out. See, remember, definition is more important. People try to remember the name, number, but more important is your definition. If functional residual capacity is telling us what is the amount of air remain in lung after normal breathe out, right? Vital capacity is the maximum amount of air we can inhale after forceful expiration. When you forcefully expire, like exhale, when you forcefully exhale, what are you removing? Tidal volume you are removing. You are removing ERV, expiratory reserve
Everything
volume.
except for the residual volume, no, sir.
Yes, everything except residual volume. But what you are removing by breathe out? Tidal volume you are removing,
We remain tidal
and
volume, we're removing.
ERV you are no. That's what. Carefully listen. What is the definition? How much you breathe in after forceful expiration or forceful exhalation? What are you removing in forceful exhalation? Tidal volume and ERV. Those two things you are removing. When you breathe in forcefully, what will you take in? Tidal volume you will take back, ERV you will take back, along with that IRV. Forcefully you are inhaling also, na? Logically makes sense. Example, if I am inhaling, like exhaling, and then I forcefully breathe in, then I inhale for long time because I am taking in tidal volume, expiratory reserve volume because I threw these two things out already. Along with that, what is extra? IRV. Makes sense? Or you can write it ulta. Like if you forcefully inhale, if you forcefully inhale, how much you can exhale? Forcefully you inhaled tidal volume and IRV, right? What you will throw out? Maximum what you can throw out? Tidal
Tidal
volume you can
volume,
throw out,
IRV,
IRV you can throw out, and
and ERV.
ERV. Make sense?
Yes, sir.
And last, total lung capacity, which is telling us what is the maximum capacity of our lung to accommodate air. So when I forcefully inhale, how much gas can be present in my lung? Residual volume is always there, always. And by forceful inhalation, I can take in tidal volume, IRV, ERV. Done. Make sense? Ask your doubt. Because what I feel this topic theoretically look difficult, but when you correlate with the real life, key, inspiratory and expiratory capacity, functional residual volume, air remain in lung after normal breathe out. Air in lung after normal breathe out. What remain always in lung? Residual volume plus expiratory reserve volume because you are breathing out normally, not forcefully. So it will stay back. Vital capacity, which is actually working during the vital condition. Serious condition, what will work? Like when you run, what will work is like you how much you can inhale forcefully. How much you can inhale forcefully, maximum. Correct? And when we talk about total lung capacity, here we are not talking about respiration. We are talking about what is the capacity of lung. After everything we take in, whether it's tidal volume, IRV, ERV. Because RV will always stay back. Not so in any route.
No doubt, sir. But when I do
Good.
questions, I keep messing it up. That's the problem.
We will do question now directly from this topic. Jordan.
Sir, got it now, sir. Only the solving part.
Uh, so if you do this, so you have four basic things. One, tidal volume, normal breathing. IRV, forceful breathing, inspiration, forceful expiration, and residual volume, stay back. By using these four, you have capacities. First, You have inspiratory capacity after forceful inspiration, which include tidal volume plus IRV. Expiratory capacity, forceful expiration, tidal volume plus ERV. Functional residual capacity, what stay back after normal expiration? ERV plus residual volume. Vital capacity, forcefully what you can inhale tidal volume, you can inhale ERV and IRV after forceful expiration. And last, total lung capacity, everything. Total lung capacity, everything. Got it? Done. You have to remember this number. Take lower number. Easy to remember because you can't remember both. 500, 2.5 liter, 1 liter, 1.1 liter. So one question can be write the sequence maximum to minimum. Maximum will be IRV, then residual volume, then ERV, then tidal volume. These number 500 plus 2.5, 3 liter. 500 plus 1, 1.5. This 2.1 liter. This um, 500 plus 1.5, 2.54 liter approximately. And this include everything. So 4 liter plus 1.1. So 5.1 liter. Question can be asked, what could be the maximum to minimum value? Maximum will be total lung capacity, then vital capacity, then functional residual volume. No, not functional residual volume. Inspiratory capacity, then functional residual volume capacity, and last expiratory capacity. Tell me, guys, any doubt?
No, sir.
If you don't have any doubt, we can go through the same paper what we were discussing directly to the point volumes. We'll first this question. Chandana, spirometer is the device that measure the volume and capacity. It can not measure the following volume and capacity except which one it can measure? Spirometer.
Sir, residual.
Spirometer cannot measure the following volume and the capacity except.
One second. Sir, is it
Answer.
TSV?
It should be 4. You can turn off your video. 4. Why? Because in option 4, residual volume is not there. In option 4, residual volume is not there. Correct? And if residual volume is not there, what will happen, Jordan? You can measure it because we
Mm.
cannot measure residual volume. It stay back. It stay back. That's why we cannot measure it. But we can measure everything else.
Yes, sir.
Got it? So question what they are asking, which one it can measure? Again, which one it can measure? It can measure expiratory reserve volume. Why? Because pyrometer can measure the thing, all the thing, but it cannot measure residual volume. So here you have residual volume cannot measure. Total lung capacity, residual volume cannot measure. Functional residual capacity, residual volume can. Got it? So while you are writing in NCRT, we wrote here, you can note down in your notes. Key here. Where is this pyrometer? Pyrometer. Huh. Volume of air involved in the breathing movement can be estimated using spirometer, which help clinically. This spirometer do not measure residual volume. Just write this. It cannot measure residual volume. Done. I am just looking for this topic. Huh. Jordan. After forceful inspiration, amount of air that can breathe out by maximum forceful expiration is equal to vital capacity.
With
You should know
velocity.
this. What is vital capacity?
So whose question is this, sir?
Your.
So option 3, no?
Yeah, done. This is given in your definition. If you calculate vital capacity, so vital capacity is the maximum amount of air a person can breathe in after forceful expiration, which include all the three. Or ulta is also there. Maximum amount of air can breathe out after forceful inspiration. Done. Direct definition. Next question. So Hina,
Yes, am I supposed to match the following?
hmm,
Sir, D is 1.
hmm,
I'll do it so one second, let me read it.
hmm,
Sir, B is 3,
hmm.
C is 4.
Done.
Yes.
Tell me, we did 2, 3 question. Did you face any difficulty in any of the question?
No, sir.
Done. You can do more. If you feel ki sir no, we need more practice. I can show you more PYQ to get clarity what is the level of PYQ. Usually coaching make it tricky, but I'll show you PYQ using C 2024. Pratigya, residual volume. A3, volume of air remaining in lung after forceful expiration. Pratigya, are you there? No. Chandana, vital capacity.
Sir, 1,
B1, C, expiratory capacity.
3.
3, volume of, no, no. C, expiratory capacity. So this will be the total amount of air expired after normal inspiration. C4 and tidal volume 2.
Yes, sir.
And uh, Jordan, expiratory capacity.
Expiratory capacity Uh, no, expiratory reserve volume plus residual volume is 4.
What are you talking about? Expiratory capacity tidal volume plus expiratory reserve volume.
Oh, wait, no, 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 no. Why am I mixing it up? It's tidal volume plus expiratory reserve.
In
Ah,
case of inspiratory or expiratory capacity, it is as simple as that. Whenever you see inspiratory or expiratory capacity, uh, huh,
So questions like those is where I make the mistake most.
questions are,
Questions with like the formula, like ERV plus TV, like those kinds of questions I make mistake.
yeah. So, example, inspiratory capacity. The simplest way is inspiration we will involve along with the normal tidal volume, IRV. And for expiratory capacity, same tidal volume and ERV. In total lung capacity, you have everything. You have everything. In total lung capacity, everything means literally everything.
Yes, sir.
Right? Functional residual capacity. As residual word is there, so residual volume will be definitely there along with the expiratory reserve volume. Here you will face most difficulty. And most popular question is vital capacity. Forcefully you inspire or expire. Forcefully how much you can expire? Tidal volume, ERV and IRV. Done. These are the four things you use in the five things in the formula. So Jordan, A, expiratory word,
option expiratory, so it's option 2, tidal volume
correct.
and expiratory reserve
And
volume.
D,
Functional residual volume.
D,
D is inspiratory capacity, so option 3, sir. Tidal volume
exactly.
plus
Now
inspiratory
it
reserve
look
volume.
easy. Two part.
Yes, sir.
Functional residual capacity. What will be should be there?
Functional residual capacity should be expiratory reserve volume and residual volume.
Perfect. And vital capacity.
Everything in total. Listen, not everything in total. Expiratory, tidal, and inspiratory reserve volumes.
Except reserve. Remember reserve you have only in two things.
Except RV.
RV you have in two things. One functional residual volume as the name says the capacity, and second is the total lung. Everything in the lung. Only in these two you have RV. One where you use word residual and second total lung. Total lung includes this also. Next, Suhina.
Vital capacity will be um, IRV plus
Hmm.
ERV
Correct. Plus
plus TV.
perfect. So it will be three. So
Yes.
you can revise it again. Vital capacity, maximum air we breathe in after forceful expiration. After forceful expiration, we are removing tidal volume and ERV. Now you forcefully breathe in. You will definitely take in these two along with this. So vital capacity, everything except residual volume. Everything except residual volume. Got it?
Yes, sir. Understood.
Sandana, vital capacity, which one is correct? First one.
First one is correct.
Second one.
So false.
B is false. Then what is this total volume of air a person can inspire after normal expiration? Inspiratory capacity.
Yes, sir.
Inspiratory capacity. C,
True, sir.
correct. This is the exact definition. D,
No, it's false.
definitely wrong. And E,
False.
correct. Both are correct. Like maximum breathe in after forceful expiration or maximum breathe out after forceful inspiration.
Yes.
See, look at this. Maximum amount of volume breathe in after forceful expiration. You can say this. Or maximum breathe out after forceful inspiration. Both are correct. Both have same meaning. Ultimately, it will reach to this only. So, Jordan,
Maximum volume of air a person can breathe in after forced expiration. You can breathe in vital capacity. Total lung capacity, I don't think it'll be. Should be vital capacity,
yes,
sir.
yes. Don't you think most frequently asked question from the capacity is vital capacity only?
Yes, sir.
Rohina,
So 1 second.
expiratory inspiratory are always damn easy.
Um, so is it 1,500?
Perfect, done.
Yes,
What
sir.
is expiratory capacity? Tidal volume plus expiratory reserve volume. Done.
Yes, sir.
We don't care about residual volume in this question.
So residual volume is there in FRC and FRV and
Residual volume present in two FRC, functional residual capacity or total lung capacity.
okay, okay. Yes, sir.
Chandana, tidal volume,
Is it 500 to 550?
perfect. Next, inspiratory reserve volume,
So is it 2,500 to 3,000?
correct. Third, expiratory reserve volume
1,000 to 1,100.
and residual,
1,100 to 1,200.
correct. You might get confused between expiratory and residual volume. Remember, expiratory is slightly less. So tell me, guys, is there any doubt from this topic?
No,
And
sir.
was it
No, sir.
really difficult? Maybe you need more practice to see more different type of question. But ultimately, like you get only same version where you need to get idea about the number. See what is the number? Jordan, the residual volume.
Residual, residual, mm, residual should be, no, they're asking which is correct. No, residual is not correct, so it can't be 2005. It should be the least. One of the
Hmm?
least, huh?
What is the residual volume amount? You are right.
1,200 ml.
Perfect. Vital capacity.
Vital capacity should be 4,500, no, sir.
Correct. Tidal volume, let's take 500. Uh,
500, huh?
expiratory reserve volume 1000 to 1500. You can take 3000 inspiratory.
So inspiratory capacity will be the correct one.
Uh, and inspiratory reserve volume
Inspiratory reserve volume should be greater than 4,500 ml also. No, should be lesser than that.
uh, 2500 to
2,000,
3000. So,
3,000. Yes, sir.
so answer is A, first one. And inspiratory
I don't
capacity.
think this will match the following, sir.
No,
This is
but
it.
still we
Because,
have to do as the following.
yes, sir,
Na?
understood. Yeah, yes, sir. Yeah.
And inspiratory capacity. inspiratory reserve volume plus tidal volume, correct? 3000 inspiratory reserve volume plus 500 tidal volume. It will be 3500. Done. So this is the topic about your this doubt. Okay. Let me solve question quickly so we can finish this part. 1600, 1136. So Hina, during the normal quiet inspiration in the human, which of the following event is primarily responsible for drawing air into the lung?
Sir, contraction of inter internal intercostal muscles and uh, wait 1 second, sir. Contraction of
Hmm.
diaphragm, right?
Hmm.
No, wait 1 second. Yeah, contraction of diaphragm, right?
Hmm.
So C.
See.
Is that correct,
Yes.
sir?
Yes, because the simplest logic you will use in this topic and very important for the conceptual clarity is that whenever there is mechanism of breathing, you know that we have to take air in. During this process, there will be always pressure gradient rule. कि air always move from high pressure to low pressure. Air always move from high pressure to low pressure always. This is first rule. Second rule says that you have to follow ideal gas equation. PV is equal to nRT. Boyle's law. कि P inversely proportional to volume. Example, during the process of inspiration, air will be taken in. It means inside the lung, pressure should be less. In air, pressure should be more. How we can do this? We can't change outside world, we can change inside. So lung that have low pressure, lung that have low pressure, how is that possible? You have to increase volume. Correct? How to increase volume? There are two methods of taking air in: diaphragm contraction and intercostal muscle contraction. That because expression will be ulta. All of you understood this?
So can you? Yes, sir. Understood.
Understood?
Yes, sir. Understood.
Inspiration, expression. There will be pressure gradient between the lung and air. During inspiration, pressure within the lung should be less. Why? Because less pressure inside, more pressure outside, so air will go inside. It means there should be negative pressure in the lung with respect to air. During expiration, it should be ulta, exactly ulta. Intrapulmonary pressure should be high. Two important things responsible for this is one, diaphragm, and second, intercostal muscle. Correct? So, what happened during inspiration? There will be contraction of diaphragm, extremely important this point. Contraction of the diaphragm is the most important thing. It will increase volume in the anterior posterior axis, front and back side, anterior posterior, because diaphragm is present posterior side. And second part is contraction of external intercostal muscle, contraction of external intercostal muscle. So these muscle will lift up the rib. If lift up the rib, then sternum will be lifted up. It will cause increase in volume again, but dorsoventral, front and back. Overall increase in volume means decrease in pressure, decrease in the lung pressure, decrease in lung pressure, air will move inside. In case of expression ulta, relaxation of diaphragm, relaxation of intercostal muscle, come to the normal position and reduce the volume, increase the pressure. Right? Increase the pressure, it will cause expulsion. And we can change the volume, like forcefully you can breathe in, breathe out by your choice. So additional muscle in the abdomen will work. This diagram is extremely important. Why? Because diaphragm is contracted, but it look like it is coming out. Diaphragm is contracted, it is looking like it is coming out. Actually, it is coming out. Diaphragm is contracting, but volume is increasing. Volume is increasing, pressure is decreasing. Inspiration. Here, though diaphragm is relaxed and arc upward, but here volume is decreasing. And when volume decrease, pressure will increase. Exhalation. Okay. So this part, the next, Chandana.
No, sir, I'm not sure.
Jordan.
1 minute. An increase in which of the following primary symptoms is the respiratory center to increase arterial CO2 H plus concentration also.
Two important things responsible for the, what you can say, uh, management of the respiratory rhythm, control management. So two are responsible for all this management is CO2 and H positive. Because most of time in the management, you don't have a role of oxygen. Mostly CO2 and H positive are harmful things. Let me ask this question. Chandana, where you face more problem? Like example, if you close your nose and mouth, so you will have urge to breathe in, correct? What is the main urge? Is it because of deficiency of oxygen or is it because of excess of CO2?
Sir,
Chandana?
deficiency of oxygen?
No, excess of CO2. That's why you during the when you close your nose and mouth, you want to exhale out quickly. Feel
Yes,
it.
sir.
You want to exhale out. You don't want to breathe in at that moment. You want to exhale because CO2 that is released in the blood is causing actual problem.
Yes, sir.
And that's why in this topic you have management regulation of the respiration. Human beings have significant ability to maintain and moderate the rhythm. This is done by the neural system. Nervous system play important role in regulation. You have specialized center in the medulla region known as respiratory rhythm center, which is mainly responsible for the management. Second center present in the pons region, and this is pneumotaxic center. It also manages the function of the respiratory rhythm. What is the role of pneumotaxic center? It reduces the duration. It means it fasts the process of breathing. Increase breathing, increase breathing rate. Okay. Other than this regulation, you have two things: respiratory rhythm center, pneumotaxic center in pons region. Third is chemosensitive area. This is present adjacent to the respiratory rhythm center, next to respiratory rhythm center, and this is highly sensitive to CO2 and H positive ion. Highly sensitive to these two. If these substances are present in the blood too much, so this chemosensitive area will get activated and do all the adjustment. So body can eliminate CO2 easily. Okay. Same way, you have receptor present in the aorta. Aortic arc means what? Artery. Or carotid artery means what? Artery. So if you have in aorta or carotid artery receptor, what is the role of this receptor? Again, same role to identify the change in CO2 and H positive concentration. Because If you don't breathe out, CO2 as positive concentration will be more and it will cause urge to breathe in. Right? That's why we are saying the role of oxygen is limited, quite insignificant. Now, look at this question, Chandana, again. Increase in the primarily stimulate in the to increase the rate and depth. CO2 and as positive will be responsible for because we want to breathe in this situation.
Yes.
Jordan,
During normal expiration, diaphragm and intercostal must no false. Intercostal and abdominal muscles actually contract. Abdomen, no major muscle contractions required. Expiration largely passive. Correct. Often fall.
yes. Because see, during the inspiration, there is contraction of the muscle, there is contraction of the diaphragm. What is happening? You have to put energy. So inspiration is active process. But if you look at the expiration process, everything is relaxation. Relaxation means no uh, energy involvement, not much energy involvement. Tuhina,
Mm. Oxyhemoglobin dissociation will be high CO2, high temperature, low pH. 2, sir.
hmm. If you see this transportation, I will take least time to explain this. Blood transport both oxygen and CO2. 97% O2 by RBC, 3% by the plasma. CO2 20 to 25% by RBC, but majority 70% by bicarbonate and remaining by plasma same way. How to transport oxygen? Hemoglobin is responsible for the transportation and hemoglobin made up of red color iron pigment. Correct? Oxygen bind with the hemoglobin in irreversible manner. Sorry, reversible. Reversible means it can break later. Form oxyhemoglobin. Each hemoglobin molecule carry maximum 4 oxygen. Remember, maximum word is important. Maximum 4. This binding of the oxygen with the hemoglobin will depend upon the pressure. High pressure, more binding. Low pressure, low binding. It also depend upon the other factor like CO2, H positive ion, and temperature. If you make curve, you get sigmoid curve. Same like plant growth and development. Correct. Same like S-shaped curve in organism and population. And where you make
So there's
this
some effect also, no, sir. It's called Bohr effect or something, right?
Bohr effect is related to this only.
Yes, sir. Which side will the curve shift?
So you have different type of situation, whether you take Haldane effect or if you talk about the Bohr shift, so and chloride shift. So uh, for this you need to know what are the factor that affects. Correct. So what happen in case of Bohr effect? There is a decrease in hemoglobin and oxygen affinity. If there is a decrease in the affinity, what will happen? There will be more CO2. More CO2 means right shift. More CO2, right shift. Less CO2, left shift. Left means like you can say more binding. More binding. Right shift means less binding. When you have less binding during dissociation, less affinity during dissociation. Got it, Tanvi?
Yes, sir.
Hmm. So, move to this. What is the criteria for this curve? Percentage saturation of hemoglobin with the oxygen and partial pressure of oxygen in mm of Hg. Curve is known as oxygen dissociation curve. and it tell us about the different factor of it. Example, in case of alveoli, in alveoli more oxygen and other thing will be low. Low CO2, low H positive, low temperature, all will favor the oxyhemoglobin. In case of tissue, more CO2 is produced. More CO2 produced. That's why high CO2, more H positive and high temperature because of the heat, ATP. And this is favorable for the dissociation of the oxygen. Correct? So oxygen bound to the hemoglobin in the lung and dissociate at the tissue. Every 100 ml oxygen, oxygenated blood deliver 5 ml of O2 to the tissue in normal situation. Normal situation. Normal situation. Done. CO2 is ulta. Ulta of this. Bonding of the CO2 with the hemoglobin. Carb amino hemoglobin 20 to 25%. Binding is related to mainly CO2 partial pressure, but oxygen pressure is also major factor. Correct? And ulta of oxygen. So don't remember all these things. Okay? This is important. RBC have very high amount of this enzyme carbonic anhydrase and very less amount is present in the plasma. Example, CO2 is released from the tissue during the in mitochondria respiration process. This CO2 will come out, bind with the H2O, carbonic acid will form. Carbonic acid further degrade and release H positive ion. So more CO2, more H positive ion. Correct? So at tissue, more CO2 is produced because of the catabolism. CO2 diffused into the blood, RBC and plasma both and form this. Alveoli ulta, everything will be ulta and CO2 will be released. Correct? That's why 100 ml deoxygenated blood deliver. This is done. Jordan, you answer this question. Tuhina.
So me or Tuhina?
Tuhina.
Sir, pneumonia is infection of lungs.
Okay.
Emphysema is um, reduced respiratory surface. Arthritis is inflammation of joint, and myasthenia gravis is autoimmune neuromuscular disorder.
Yes, autoimmune disease, gravis, grave disease, neuromuscular disease.
Yes.
So if you know this, so we can do disease part. Asthma, difficulty in breathing, wheezing issue, and what is the main reason? Inflammation of bronchi and bronchiole. This is what is important, bronchi and bronchiole. Emphysema, long-term disorder, long run, affect the alveoli, damage it, and reduce respiratory surface. And main cause is cigarette smoking in case of emphysema. Occupational respiratory disorder because of mostly dust. Correct? In the grinding and stone breaking industry, dust reduce and it affect the defense mechanism. Long exposure can lead to the fibrosis and cause serious lung damage. Example, in case of worker of the industry, example, this KGF movie. Whenever there is a mining industry, you will see they wear this mask kind of thing, special mask for dust. Correct? Done. This part done, this part done. Oh, so many things are done. This part done, this part done. Wow. Jordan, tell me how much time we took to explain this thing.
40 minutes, I feel.
Exactly. So, next, exchange of gases. Alveoli is the main thing through which all the gases are exchanged. Correct? Two main thing is blood and tissue. Because blood will transport oxygen to the tissue and blood will get CO2 from the tissue. Correct? Main reason mechanism for the transportation is simple diffusion and because of the pressure gradient difference in the partial pressure. Who will decide? What are the factors that decide the speed of the reaction? Diffusion, speed of the gaseous transportation. Two important factors is solubility, more transportation. Thickness of the membrane, more thickness, less transportation. Correct. So pressure of individual gas is known as partial pressure. Example for oxygen this, for CO2 this. Correct. This is the table. Very important and need ask one question from this. Like about 159 in air, alveoli less. That's why oxygen can easily move from this to this. Now deoxygenated blood had very less amount of oxygen. So it can easily move to this and become this. Remember, we are not transporting from 40 to 95. After addition of oxygen pressure will increase to 95. It is increasing, not transporting like this. And then from oxygenated blood, it will go to tissue to 40. Anybody have doubt? In CO2, you have to take it ulta. In tissue, you had high pressure 40, and in oxygenated blood, it was 40. So from tissue, it will come out to the oxygenated blood. After adding into the blood will become deoxygenated. It will become 45 because CO2 pressure will increase. More CO2 pressure. Then it will enter into alveoli, and from alveoli to air. Again pressure gradient. Tell me guys, any doubt? Same thing is given here. 104, 95, and here it will be 40. Here 45, it become 45, 40, and then expired. Correct? So you know CO2 solubility is 20 to 25 higher. That's why you can easily transport CO2 easily compared to the oxygen. Correct? If you talk about the diffusion membrane through which it will pass, have three major layers. Thin squamous epithelium of alveoli, thin layer, blood vessel, endothelium, and layer between these two, basement membrane. Right? Then total thickness is very less in this case, and due to very less thickness, all the factor will favor in such a way that oxygen can easily enter from alveoli to blood, and CO2 can easily pass from the blood to the alveoli. Correct? Any doubt? See, squamous epithelium, one celled thick, endothelium of blood capillary, and you have basement membrane. Okay. The majority part done. Did we miss anything important? We did not. Some part, introduction part are left. We'll do according to the question. Tuhina is done. Paramecium that we'll do in the another chapter. Heart muscle, motor unit, calcium, scapula, progressive degeneration. Chandana, chemosensitive area of the respiratory center in the medulla is affected by
Sir, it says CO2.
high CO2 and H positive concentration. And this is given in the regulation management. See, you have this chemosensitive area adjacent to the respiratory rhythm center, highly sensitive to the CO2 and H positive ion. Highly sensitive to the CO2 and H positive. So if these CO2 and H positive is high, chemosensitive area will get activated. Right? Increase in these substance means increase in CO2 and H positive will activate this center. So in turn, give signal to the respiratory rhythm center and respiratory center will make fine adjustment. So all these can be eliminated from the respiratory system. Any doubt?
No, sir.
Jordan. Oxygen hemoglobin dissociation curve will shift to right. Remember, a right shift. So there will be more CO2,
More CO2
more
concentration.
H positive,
H plus
Dissociation, right, sir?
less,
more temperature. Yes,
more
dissociation.
temperature and less O2. No,
Less
basically
pH.
pH.
More H positive, less pH.
Decrease of pH. Option 4.
And decrease in the pH. Option 4. Done. So remember just only one thing. Shift to right, dissociation. Shift to right, dissociation. I will write here. Just remember one thing. Shift to right, dissociation of hemoglobin and oxygen. Hello. Because of high CO2, high H positive, low pH. जी डॉक्टर साहब,
जैसे कंपनी सर्च कर ली ना, मतलब उसके 2-3 जगह हेडक्वार्टर है, जो भाई दिल्ली में भी है कंपनी, वो मुंबई में भी है।
हाँ,
तो एक ही जगह के उठाने हैं अपने, अगर प्लेस कहाँ लगे।
इंडिया के अंदर कोई भी एक
Employee-
सब चलेगा। इंडिया के अंदर सब चलेगा।
अच्छा अच्छा,
इंडिया का भी हेडक्वार्टर
मतलब-
मैटर नहीं करता।
मतलब दिल्ली के भी ले लिए एम्प्लॉय, 2-3 नाम, और मुंबई के भी ले लिए,
कोई दिक्कत नहीं।
दोनों जगह। अच्छा, पर एक जो कर लिखा नहीं आपा फॉर्मेट में, थोड़ा जो कर कहीं तो राइट साइड में लिखा जाओ, कहीं लेफ्ट साइड में फोन नंबर, वो अपने आप एडिटिंग हो करेगी।
फोन नंबर कोई दिक्कत
आज
नहीं, उसमें
मैं-
आगे लिखा है या पास से लिखा है, उसमें कोई दिक्कत नहीं। मतलब रवा तो सही है नंबर।
हाँ हाँ,
बस फिर कोई
डिटेल
दिक्कत
तो
नहीं।
सारी सही।
कितनी डाटा हो गया
एक बार
डॉक्टर साहब?
डाटा तो यार बहुत थोड़ा हो जाएगा भाई, स्पीड बहुत कम पकड़ी जा रही।
कितनी?
वाले 12-13 कंपनी का है, उसमें तो अभी 2-3 कंपनियां तो अवेलेबल होता है नेट पे।
कोई दिक्कत नहीं। फिर ये आपकी स्पीड भी तो बढ़ गई होगी, जो आपने स्टार्ट किया था पहला दूसरा
हाँ,
तीसरा।
ये बढ़ जाएगी, बिल्कुल बिल्कुल।
ये आपने फील हो गया होगा एक तो स्पीड में।
हाँ, एक थोड़ी सी पहले है, देखो बाकी ट्राई करते हैं।
हाँ, कोई दिक्कत नहीं है, जितना वो है करियो। लेकिन बस न्यू है कि
हाँ।
यो एक नया एक्सपीरियंस है, तो जरूर करके देखो, मजा आएगा।
हाँ बिल्कुल बिल्कुल बिल्कुल।
हाँ, जो कोई दिक्कत आज में झिझक फोन कर लियो।
ठीक है जी।
तो इसमें किसी भी हेडक्वार्टर में तो अपना कोई दिक्कत नहीं है। और दूसरी बात कि यू अगर आगे पीछे हो जाए तो वो कोई दिक्कत नहीं, बस मेक श्योर करियो कि वो +91 और जो गैप है नंबर के बीच में वो आप रिमूव कर दो।
हाँ, वो ध्यान है।
हाँ।
वो ध्यान है।
हाँ,
और ये जो कैपिटल अक्षर वाली में पहला अक्षर देखो नाम का,
वो मैटर नहीं करता, वो तो कुछ भी चलागा।
बुरे भी लिखी तुम।
हाँ, लेकिन कैपिटल में थोड़ा सा सूत्रा लग गया है।
अब मैं कोशिश तो वही कर रहा हूँ।
हाँ
अभी तक तो सारे कैपिटल लिख रहा हूँ। फिर
हाँ,
वो बार कैप्स लोग किताब टाइम लग गया जिसे, तो कुछ
जी आप कॉपी करो तो उसमें भी तो मोस्टली कैपिटल में लिखा हुआ है पहला।
कॉपी जो कर नाम तो कॉपी होता है वो नहीं यार,
क्या था?
नाम तो मैंने टाइप करना पड़ा है, और डेस्टिनेशन
टाइप को नहीं करना, आपने ऑर्डर सेलेक्ट कर लियो ना, सेलेक्ट करके Ctrl+C।
मैकबुक है, थोड़ी मैकबुक में मेरे की दिक्कत हो है, मैं कल माउस लिखाऊंगा, बिना माउस के होता है वो नहीं।
हाँ, माउस हो गया मेरे से अपना करना पड़ेगा, वरना तो ऑर्डर तो सेलेक्ट करके Ctrl+V तो दबाओ कहाँ पे।
तो जो नाम और डेजिग्नेशन तो टाइप करना पड़ा है, बस ईमेल और फोन नंबर कॉपी हो जाए।
हाँ, तो फिर डेजिग्नेशन आप शॉर्ट में लिख लो, आसान होगा आपको सकता।
हाँ, वो कोशिश तो वही।
हाँ डॉक्टर साहब, और कोई दिक्कत आओ तो बता दियो।
हाँ ठीक है भाई।
ठीक है,
ओके।
थैंक यू। डन गाइस। 149। whose turn was this? Tuhina, first statement.
So 1 second, I'm reading. True, sir.
Hmm.
So second one is
Second.
false.
Hmm.
True.
Hmm.
True, sir.
Then
Yes, sir.
Chandana. Chandana.
Yes, sir. So,
Favorable for the oxygen. Oxygen should be high, other should be low. As simple as that. And in tissue, it will be ulta. Whenever more oxygen you want to transport, so oxygen pressure should be high, other should be low. So this first one is wrong, second one is wrong, third one is correct. Fourth. Jordan.
With what is the primary function of pneumotaxic center in the regulation of respiration of human beings? Decreases duration of inspiration, decreases rate and depth, access switch on point for inspiration, control switch off point for, so option 3. No, it can't be switch on. Okay. Yes, sir. Decreases duration of inspiration. So this part I had, they've mentioned some other things in the notes. I sent on WhatsApp my doubt.
What is written in the NCRT is what matter.
So
Reduce
they're
the
given outside
duration.
and they've asked the same question. That's why a little bit
See,
scared I
reduce the
was.
duration of inspiration.
Inspiration,
Remember what one thing. Which test you are preparing for, NEET or PALAS test?
Neat. But that
Exactly.
one's marks.
That's all. As simple as that. Doesn't matter. What is given in NCRT will be valid everywhere. NT is not bothered about who is coaching you.
So, but then, like, you know what my dad will do if I don't score marks?
You will score marks if you do right. Are they getting too much out of NCRT? No.
No.
Exactly done. Tanvi,
So which question?
154.
The first one is true.
Hmm.
Um, Second one is false. It's incomplete.
Hmm.
Terminal. True, sir.
Alveoli.
Oh, bronchi. Oh, I didn't read that last word. Sorry. Uh,
Read carefully.
larynx is a cut. True, sir.
Hmm.
So A and D are true. Yes, sir.
Correct. So, this is given in your introduction. Uh, pair of external nostril above the upper lip, then nasal chamber through the nasal passage. First nostril, then nasal passage. One, two, three, then four. Pharynx. Pharynx is the common passage for air and food. Pharynx, then larynx, then trachea. Larynx is the cartilaginous box which help in the sound formation. That's why sound box. During swallowing, glottis will be covered by thin cartilaginous flap epiglottis. So covering of glottis is epiglottis, thin elastic cartilaginous flap. What is the role? Prevent entry of food into larynx. Trachea, straight tube in the mid-thoracic cavity, divide at fifth thoracic vertebra into bronchi. Each bronchi then form primary, secondary, tertiary, and end up the thin terminal bronchiole. All this is very important. Whether you take trachea, primary bronchi, secondary bronchi, tertiary bronchi, or initial bronchiole, All are supported by incomplete cartilage thing, except alveoli. Okay. Each terminal bronchiole give rise to thin, irregular wall vascularized bag known as alveoli. This bronchiole alveoli will form your lung. We have two lung covered by a double layer pleura with pleural fluid between them. What is the role of pleural fluid? Reduce friction. So layer will not rub against each other. Outer membrane will come in contact with the thoracic cavity and inner. हाँ जी डॉक्टर साहब
हाँ, दीपक एक चीज होता है वही,
बिल्कुल
जैसे एक कंपनी IIFL फाइनेंस लिमिटेड
हाँ
लिमिटेड लगे हुए नाम के पीछे है
ओके
लिस्ट में, तो
हाँ
शीट में, और सर्च करना तो सिर्फ नाम उसका IIFL फाइनेंस है,
चलेगा
चलेगा वो भी,
बिल्कुल चलेगा डॉक्टर साहब
मतलब लिमिटेड नहीं है नाम में।
ना कोई दिक्कत नहीं
अच्छा ठीक है भाई,
ठीक है डॉक्टर
ओके।
साहब तो heart from external nostril to the terminal bronchiole except alveoli will form conducting part and alveoli and its duct will form respiratory or exchange part, correct? So what is the role of the conducting part? Conducting part will transport air to the lung, clear or from the foreign particle, provide humidity, bring fresh air, maintain temperature, everything, all the function, transportation, removal of the filtration, humidity, temperature maintenance, everything. Exchange part have only one role. Exchange part or respiratory part. Gaseous, gaseous exchange between the blood and air. Last topic, where these lungs are situated. Lungs are situated in the thoracic chamber, in airtight chamber. Dorsally, dorsally means backside. We have backbone, vertebral column. Front side, we have sternum. Sidewise, we have ribs. Lower side, we have dome shape diaphragm. And all this setup is managed in such a way that if there is any change in the thoracic cavity, it will be reflected in our lung cavity also. Correct? And we cannot directly alter the pulmonary volume. Very, very, very important. In the incorrect statement, you will get this. We cannot alter the pulmonary volume. Steps in the respiration. First, breathing or pulmonary ventilation in the lung. Then, gases will enter into the alveoli. Then, blood. Then, diffusion between the blood and tissue, and ultimately utilization of oxygen by the cell. Cellular respiration. Correct. Pulmonary ventilation in lung and cellular respiration in the cell. Done. Correct. Jordan, we took 1 hour.
Yes, sir.
So next time, it's okay. Like I can't blame you guys because you don't know how to manage. That's why I believe ki ki okay, biology is easy, we can do it. But timing is crucial. How much time do you spend to make it good? Do you spend 5 hours or you make same thing in 2 hours? Jordan 157.
Occupational lung disease is characterized by no option one is false. Proliferate five. I think it's option two. So, how it's option two fibrous tissue. No, no.
Fibrous tissue. In the last part, see, low exposure gives rise to the inflammation leading to the fibrosis or proliferation of fibrous tissue and cause serious lung damage. Done. This is muscle. Chandana, Is this correct?
Yes, sir. True.
Second, functional residual volume. Both are correct.
Yes, sir.
Correct. After normal expression, what remain in lung? What remain in lung? ERV plus residual volume. ERV plus residual volume. Jordan, 160.
Statement 1, the diffusion membranes compose of squamous epithelium of alveolar capillaries, endothelium, alveolar and basement membrane. Squamous epithelium, not alveolar capillaries, shouldn't be just membrane. Then second,
Yeah. First
uh,
statement correct or wrong?
wrong, sir.
It should be epithelium of alveoli, endothelium of blood capillaries.
Endothelium and blood capillaries. Nearly 25% of CO2 is transported by RBC, 70% is transported by bicarbonates. That is true. Statement 1 is incorrect. Statement 2 is correct. Option 2.
Any doubt? Tanvi.
So 1 second. So first one is true.
Hmm.
Less than atmosphere. No, sir. False.
Third.
Partially CO2 and deoxygenated blood is 40. It's 45, no, sir.
Yes.
Chemosensitive area situated in. True, sir. True. So 1, 4, and 5. Option 2.
Chandana.
Sir, is it options 3?
Yes. In conducting part, only conduction, no gases exchange. For exchange, you have alveoli exchange part. Jordan. In artery.
So my question was, in PO2, arteries, it will be option 3 is 95, and then CO2 will be for 40.
Correct. Tanvi.
Yes, sir. 1 second. Tissue respiration. True, sir. Left. No, sir. It's right shift, right?
Yeah. Chandana.
Yes, sir. 2.
One is basement membrane. 4 is the squamous epithelium of alveoli. 3 is blood cell RBC. This is basement membrane. This is blood capillary endothelium. This is alveoli.
Yes, sir.
Tell me, guys, was this chapter really difficult? And anywhere you faced issue? So if you didn't face issue, let's finish this part also. Why to leave? You never know where you get question. Hmm. Mechanism of breathing depend upon where organism live, whether water or air, and level of organization, whether the cell, tissue, and all. In case of organism like early organism, there is mostly simple diffusion by entire body surface. In case of earthworm, you have moist cuticle. In case of insect, you have tracheal tube. In cockroach also, there are gills by aquatic arthropod and mollusk. Aquatic arthropod and mollusk. Lungs, pulmonary respiration in the terrestrial form. In case of vertebrate, fish use gills, amphibian reptiles, bird mammals use lungs. Amphibian have cutaneous respiration through the moist skin as well. Correct. This is normal thing. Oxygen utilized by the organism to indirectly break down simple molecule. This indirectly what is important to derive energy. CO2 is harmful, which is released during the catabolic activity, and oxygen is continuously provided to the cell. CO2 is removed. This exchange of is known as breathing, commonly known as respiration. Correct? Done. Every single thing is done. Alfonso Corti, you don't have in portion because you don't have ear. But still, for your mental satisfaction, you can say कि organ of Corti was popular structure. He studied cardiovascular system of reptiles. Later, he turned attention to the auditory system, ear. He published a paper describing the location of the basilar membrane of cochlea in ear, contain hair cell, and these will convert sound vibration into nerve. And now we have organ of Corti after Alfonso Corti. Nothing special in this case. See, you have same reductionist approach to study life form result in the increasing use of physiochemical concept in chemical. Most of time it is cell-free system. Molecular physiology is synonymous to the biochemistry and biophysics. Molecular physiology. This emergent property is given in the living world due to the interaction of the system like tissue property due to the interaction between the cell. Correct? And each and everything is done from this. Second thing, first we'll do bone. Bone are easy. You want 10-minute break?
Yes, sir, 10 minutes will be fine, sir.
Yeah. So take a small break and then we'll continue with the locomotion. 15-minute break. You can take it. Yeah. So let me see. 136 we are done. 37, 38, 39, 40, 41, 42. $151. Jordan. X pair of ribs in human only. Y pair of ribs. Out of X
Floating.
pair of ribs, only Y pair of ribs are floating ribs. How
Out of
many?
12 pairs of
Hmm.
ribs,
Hmm.
there are three floating ribs. No, not three ribs.
Two,
Two.
11
No,
and 12.
I was reading the first option. I was like, huh. There are two floating ribs only, sir, and are dorsally attached to the vertebral column, but are free on the ventral side. Yes, sir. They're not attached to the sternum.
And out.
Yes, sir. So, but then the number of false ribs would then be three, no, sir. But floating will be two.
False 3 pair, floating 2 pair.
So, just one question. So, why aren't the floating ribs considered under the false ribs category?
No, the definition criteria is different because floating
False
ribs
are
is
attached
floating because they are
indirectly.
not attached anywhere.
Huh.
Huh.
Okay, understood.
So, Tohina, true ribs, 10 pair, is this correct?
No, sir, it's 7.
Floating ribs, 2 pair, is this correct?
Yes, sir.
Hmm. Hmm. Smooth macrophage. You have many questions from the muscles and disease. So we will make it fast. Appendicular skeleton is easy to correlate. Bone associated with the limbs and with their girdle. Girdle are six. Total contains 6 bone here and limbs 120 will form the appendicular skeleton. Each limb 30 bones. 4 limb contain humerus, funny bone, radius and ulna. Carpal, your wrist bone, 8. Metacarpal, after your wrist, palm bone. Correct. Write this. Key carpal is known as wrist bone, metacarpal, palm bone. Phalanges, digit 14. 2 in the thumb and 3 in each finger. In the hind limb, you have femur, thigh bone, longest bone. Thigh bone is the longest bone. Tibia, fibula. Instead of carpal, you have tarsal, ankle bone 7, metatarsal 5, phalanges digit again 14. Correct? So every hand have 30 bone, every leg have 30 bone. But if you see, you have femur in case of leg and humerus in case of hand. Radius ulna in hand, tibia fibula in case of leg. Correct. Carpal in hand and tarsal in case of leg. Interesting point is if both number are same, but in your wrist you have 8 bone, in your ankle you have 7 bone. Where is one bone, Tuhina?
Sir, I didn't understand.
Everything else is same. Only difference is you have wrist bone 8 and ankle bone 7. But we also said every hand or leg contain 30 bone. Where is one bone from the leg? If bone is same, but here you have bone different.
Sir, in the patella, like the knee bone.
Okay, yes. You have patella. Patella will cover ventrally front side, kneecap. Right? What is the shape of this bone? Cup shape. It is cup shape, cover the knee. Very strong. Tanvi, I know you must have done this, but tell me,
Yes, sir.
have you hit someone with your knee
Yes, sir.
using your patella?
Yes, sir.
So
And this
yes,
is
she's done it to
oh,
me.
eh?
I've
Yeah,
done
she
it to
beat it.
Jordan, sir.
Yeah, I am the one who experiences
Seriously?
all this. Yes, sir.
Why?
So why not?
So,
Simply we'll keep fighting, so that's it.
so
You don't know
she
what's
and
Okay.
this other one of a friend, I have video of them chasing and actually beating me with their legs and all.
Okay. Wow.
You see, we didn't
But,
kick him, but we were beating him up. That's all.
So they were crying, and then the very next moment, I take out my camera to record that precious moment. They start beating me.
okay. Because patella and elbow joint, like knee and elbow, hit hard.
Yes, sir. You should ask Jordan how it felt.
So then how it felt?
So no, sir, it hurts. That's all I can say. It's like some not so good piercing pain.
Not so. Which pain is the good pain?
There's no good pain, but then like it's something which is bearable and something which is not bearable. That way I meant.
Okay. Okay. So your appendicular main bone part is done. Girdle is left. Pectoral in your shoulder and pelvic in your pelvic area. So pectoral will attach your upper part and pelvic lower part. Correct? Each girdle have two half, left hand side, right hand side. Correct? Each pectoral girdle have two bones, one upper clavicle and one triangular shaped scapula. Correct? Clavicle and scapula. If you see scapula, your scapula bone is triangular flat bone. Ribs are also flat. Sternum is flat. Scapula is flat. Back side placed between the second and seventh rib. Remember rib, not bone. Rib, second and seventh rib. This back side you placed flat scapula have elevated ribs, some slightly growing part. This is known as spine. Spine is elevated outside and spine have expanded process, flat process. This process is known as acromion. Okay, so you have scapula triangular shape between second to seventh rib, have elevated spine and expanded project process acromion. Correct? And clavicle is attached to the acromion. Clavicle is attached to the acromion. Correct? Below the acromion, where your humerus attached to the where your humerus attached to the this scapula bone and from the shoulder joint, there you have glenoid cavity. I will show you diagram because most of the people can't imagine this glenoid cavity where your humerus will attach to your uh, humerus attached to the glenoid cavity and from the shoulder joint. Correct? Let me show you this diagram. Glenoid cavity. See, you have triangular shaped scapula. At acromion, clavicle will attach to the scapula. Glenoid cavity, a cup-shaped structure where humerus attach. Correct? Okay. You have acromion at the top where you have your clavicle attached. Glenoid fossa means cavity where humerus attached, and other triangular shapes. Scapula. Scapula is extremely, extremely, extremely important. Correct. So, what happened? Am I audible, guys?
Yes, sir.
Yes, sir.
So, clavicle, long, thin bone, collar bone, correct? Beauty bone in case of ladies. I don't know why it is not beauty in case of men. It's beautiful in everyone.
Yes, sir.
Isn't it
Sexism
true?
at
Gender
its
equality.
finest, sir. Yes,
Eh?
sir. Sexism at its finest.
Yeah. In Jordan, it is finest.
Oh God.
Yes, sir. Yes, sir.
No,
Humorous.
people are very jealous. I can just tell you that people are very jealous.
Okay, people are jealous from you
Yes,
because
sir.
of your collarbone,
Yes, sir.
because it
I'm
is
very big
beauty bone
collarbone.
in you.
Yeah, it's very beautiful for me, sir. That's why.
Okay. So toward thumb you have radius, away from thumb you have ulna. Correct? Remaining thing is as usual.
So, is it true that the radius crosses over the ulna when our palm is facing downwards?
Hmm, radius cross the ulna. No, their position, bone position always remain fixed.
No, so like the bone position is fixed, but then they cross over each other, no? Because if,
How?
because if you look at it, they're two straight bones. When
Uh-huh.
we're twisting our hands left to right or right to left, they can't be like straight, no? Otherwise, they'll have to switch from the joints, like their sockets.
What?
Uh,
No, Tanvi, it's okay, you're not beautiful enough.
Thanks, Jordan.
we are going beyond beauty.
Have I moved? You're at the radius and ulna.
Hmm. Radius ulna. So remember radius toward thumb. Radius toward thumb.
Because of radial artery, no, sir.
Yes, correct. And if you see that we are going to discuss about the pelvic girdle, there is single bone in pelvic girdle. That is coxal bone. One bone, coxal bone. Coxal bone further made up of three bones. Ilium, ILI, ischium, second this uh, U shape, and then pubis. So ilium, pubis, and ischium. Correct. So these are the three bone present in the coxal bone. Remember, you have one coxal bone one side. So total two coxal bone. So in pectoral girdle you have four bone, and in pelvic girdle you have two bone. Correct. Pelvic girdle you have two bone, two causal bone, and in pectoral girdle you have four bone, two clavicle and two scapula, two clavicle, two scapula, and these causal bone made up of the fusion of three bone, ilium, ischium, and pubis. Ilium, ischium, and pubis. How you have glenoid cavity in pectoral girdle, same way in pelvic girdle, you have acetabulum. You have acetabulum. At acetabulum, like how humerus articulate with the glenoid cavity, here your femur bone, thigh bone will connect here. Here you will have acetabulum. Here, acetabulum. Correct. These two half of the pelvic girdle will meet ventrally, interact with each other ventrally, and it will form pubic symphysis. And this pubic symphysis have fibrous cartilage. Remember, in ribs we were talking about hyaline cartilage. Here you have fibrous cartilage. Whether they fuse ventrally or dorsally, ventrally. Which symphysis is formed in the pelvic girdle? Pubic symphysis, pubic bone.
Yes, sir.
Correct. So two coxal bone, femur, Tibia fibula. Tibia fibula. Toward the thumb, you have tibia. Toward the thumb in hand, you have radius, fibula, and all other bone. Tell me, any doubt? I think you had one question from this also. Where is your oh last question about the disease? Last question cover everything about the disease. So let me ask this question. Jordan, myasthenia gravis is autoimmune disorder that affect the neuromuscular junction.
Uh, True, sir. That weakening fatigue disease is this only.
This is true because if you read about the disease, myasthenia gravis, very popular autoimmune disorder that affect the neuromuscular junction, lead to fatigue, weakening, and paralysis of the muscle. Next, Tuhina, muscular dystrophy.
True, sir.
Yes, do this and give me a few minutes. Hmm. So, this part, myasthenia gravis, autoimmune disorder where immune system damage its own cell, autoimmune disorder. It damages neuromuscular junction between the muscle and nervous system. And because it is not working properly, so energy will be less. Less energy means fatigue, weakening, and paralysis of the skeletal muscle. Muscular dystrophy. Dystrophy means destruction of the muscle. As muscle is destroyed, there will be the progressive degeneration of the skeletal muscle, and it is a genetic disorder. It is genetic disorder. Genetic disorder, it damages the muscle. Correct? Progressive means continuous process. Dystrophy means destruction, and that's why degeneration of the skeletal muscle. Remember, muscle. Tetany, rapid spasm while contraction of the muscle due to low calcium in body fluid. Remember, low calcium in body fluid, not in bone. Low calcium in body fluid, not in bone. Arthritis look easy, inflammation of joint, osteoporosis. You had 2, 3 questions in this paper. Osteoporosis. Related to age, less bone mass, high chance of the fracture, and it is mainly because of the less estrogen level. Because of less estrogen level, especially more common in female. So both of you must be aware about the osteoporosis in your grandparents.
Sir, it happens in postmenopausal women, especially, right?
Yeah, that's why decreased level of estrogen after the menopause.
Yes, I'm aware of this.
Yeah, like almost every grandmother go through this phase.
Yeah, my grandma's gone through it now. She has knee replacement and all that.
Yeah, like their bone mass is so low, they are very sensitive about the movement.
Ah,
They
that is true.
the kind of movement we carry, they don't because they know less bone mass easily there is a high chance of fracture.
Yes,
And
sir.
last, same joint inflammation like arthritis, but because of the uric acid crystal, because of uric acid. Now look at this, Jordan. Fifth statement: tetany is the rapid spasm in the muscle due to the low body and low calcium in
Of
the body
calcium
fluid.
ions. Fifth
Correct.
one's correct. Yes, sir.
Uh, Tuhina, osteoporosis is age-related disorder characterized by the decreased bone
Yes,
mass
sir.
and increased chance of fracture.
Yes, sir.
Jordan, gout is the inflammation of joint due to the accumulation of the calcium crystal.
Gout is uric acid, no, not calcium.
Uric acid crystal. Done. So this part is done. We are done with this. This done. This is done. Now, Tuhina, sternum is a flat bone. present ventral midline of thorax. Pratigya is still there. Wow.
So she was always there, so surprised I didn't know.
Pratigya, are you there?
So that's correct, sir.
Yes, sternum is a flat bone and
So can I
ventrally
go wash
present.
my face and come?
Sure. Jordan, cartilaginous joint allow limited movement.
Oh, yeah, it's true. They allow
Hmm.
limited movement, huh?
And fibrous joint do not allow any movement.
That is true. It doesn't allow any.
And force generated by the muscle is used to carry out movement through joint where muscle act as fulcrum.
So true.
Joint act
Oh,
as
okay.
fulcrum.
Joint. Fulcrum is the point that rotates about, huh?
Joint are the point of contact between the bone or between the bone and cartilage.
Bone and cartilage. It's true.
That's true. See this. Joint are essential of all type of movement. So if you want to do any movement in body, all type of movement you need joint. Correct? Involving the bony part of the joint include the bony part as well. Correct? Next, locomotory movement are no exception to this. Joint are the point of contact between the bones. See Jordan. Joint are the point of contact between bone or between bone or cartilage. Second part is
Yes,
important.
that's true.
Then force generated by the muscle is used to carry out movement through joint. Correct? Where joint act as fulcrum, not muscle. Joint act as fulcrum. Joint act as fulcrum. Mobility at the joint depend upon the multiple factor and the three major structural form. Remember this word. Structural form of the joint is this. First, fibrous joint, no movement. In the flat skull bone, skull bone are attached with the help of fibrous bone. No attachment. Sorry, no movement. End-to-end fusion with the help of dense fibrous connective tissue. So you have dense uh, fibrous cartilage in pubic symphysis and dense fibrous connective tissue in this fibrous joint, and it forms suture to form the cranium. So cranial bone are attached to each other with the help of fibrous joint and fibrous connective tissue. Second, cartilaginous joint with the help of the cartilage again between the two adjacent vertebra in vertebral column and limited movement, Jordan. You answered this, limited
Yes, sir.
movement. Last, synovial joint, fluid filled synovial cavity between two bones. You have considerable amount of movement, good amount of movement. These joint help in locomotion movement. Ball and socket joint, as the name suggests, ball is like humerus ball and socket is like pectoral girdle. Hinge joint between your at knee joint. Knee joint is hinge joint. Your elbow joint is also hinge joint. You can feel it. Hinge. You know how hinge work in the door. Pivot joint between atlas axis. Atlas is first vertebra. Axis is second vertebra. It is your like no. When you say no, then your atlas move over axis. Then gliding joint between the carpal. When you rotate your uh, arm, sorry, this wrist for the exercise. So gliding joint. Saddle joint look like saddle. Very important between the carpal and metacarpal of thumb. Carpal and metacarpal of thumb. If you know this, so this is correct. This is wrong because joint. This is Fibrous joint, correct. Cartilage, allow limited. This is correct. So which was wrong? Only second was wrong. 1, 3, 4, 5, correct. Only second was. Now we will cover everything. Hmm. So Hina, are you there?
Yes, sir.
Yeah. Each thin filament of the muscle fiber is made up of.
Sir, I think it's one.
Not two
Filament.
pair.
No, oh, wait. Two F filament is yes, sir. Second option.
Correct. You have two F filament.
Sir,
You have two F filament in case of actin, and in case of myosin, you
it'll
have
be helically wound.
meromyosin. Correct.
So
So
which one? Helically wound.
helically wound is this only. F with tropomyosin.
Okay, sir.
F with the tropomyosin.
It's
So
a
this
direct
part is,
NCRT line. That's why I thought.
yeah. See, structure of contractile protein. Actin is known as thin filament, made up of two filament actin, and these are helically wound to each other. F actin made from the G actin. F actin is like long row of balloon, and each balloon is G actin. Two filament of tropomyosin and also run throughout the length of the F actin. So both this F and tropomyosin are helically wounded. You have troponin at regular interval, not continuously at regular interval. Remember, if you see tropomyosin is throughout the length present along with F. But if you see troponin, it is present at regular interval, not throughout the length. Correct? And when it is present in the resting state, troponin will mask the active binding site for the myosin on the actin filament. So this whole structure is actin. This whole structure is actin. When there is resting stage, when there is no contraction, actin should not attach to the myosin. Actin should not attach to the myosin. So this troponin mask mask actin. Why it mask actin? So this myosin should not bind to this. Second part is myosin, thick filament. Again, polymer protein made up of multiple units. Monomer unit is known as meromyosin and constitute one thick filament. Constitute one thick filament. Meromyosin have two parts: globular head with the short arm and a tail. So globular head is known as heavy meromyosin and tail light meromyosin. Head with a short arm is projected outward. You can see in the diagram. Projected outward. See, it is like this, helically wounded, then projected outward. Helically wounded, projected out outward. Correct? And here you have cross arm. So what is cross arm? Cross arm is head with short arm. This is head part. This is short arm. Both together is cross arm. Both together is cross arm. If you see globular head of the heavy meromyosin, it have ATPase enzyme activity for the ATP binding and for the actin binding. See, there are two places. One for the attachment of actin, second for the attachment of ATP. Actin attachment and ATP attachment. Why? Because when ATP bind to the myosin, there will be enough energy for the movement. And whenever there is actin, myosin and actin together will be responsible for the contraction movement. So binding between actin and myosin plus ATP is responsible for overall binding. So this answer was correct. Jordan, fast muscle fiber fatigue quickly.
True.
Correct. They depend upon mainly anaerobic glycolysis.
Anaerobic. That I think is false, sir.
Hmm?
Is it false?
Correct.
Uh,
Both are correct.
both. Okay, huh.
Fast muscle fiber means white muscle fiber. White muscle fiber, not red. Both are correct, and it is correct explanation. Why there is fatigue quickly? Because there is anaerobic respiration, and anaerobic respiration have limited energy, limited ATP, limited energy, limited ATP. What will happen? Quick fatigue. See this?
Sir,
Yes, Tohina.
sir, I already did this paper. Can I leave and study by myself?
Mm, we can do another paper because this part is important. You will face more issue in the
Yes, so there's
muscle.
some parts I want to revise, that's why.
Yeah, I'll teach because uh, for bone part I don't mind. For breathing and other part I don't mind. But in muscle you will face issue.
So breathing, I'm fine. Cell also, I'm fine. Locomotion
Mm.
also, most of the questions I'm able to do. Muscle part I need to go through, but cell cycle, cell division, I still have problem.
Where
I was
you have
planning on
issue.
doing PYQs for that.
Okay, like do you have any issue in the understanding or any particular topic?
No, I understood everything. I just need to solve more questions. I don't have any doubt as such in that chapter.
Hmm. But whenever you do cell cycle and cell division, make a quick summary.
Yes,
Example,
sir.
you know cell cycle have two part, interphase and M-phase. Interphase have three part, G1, S,
S and
G2.
G naught. Oh, sorry, G2. So G naught is when nothing is happening, right?
Yes.
It's
So
paused.
sometime from the G1, cell will exit into G0.
Yes, sir.
G1, most of the organelle will divide. S, two thing, DNA
DNA replication.
double, centriole double, chromosome same. G2
Yes,
preparation
sir.
for the M. This M have two part again, karyokinesis and cytokinesis. Karyokinesis again four part, prophase, metaphase, anaphase, and telophase. Prophase condensation, centriole movement toward opposite pole, nuclear membrane, nucleolus, endoplasmic reticulum, and Golgi body disappear. Done. Metaphase, play at equator at plate, most of thing will align, and chromosome is clearly visible. Clearly
Yes,
visible.
sir.
Anaphase splitting of centromere and movement of the chromatid toward opposite pole, and telophase opposite to prophase.
Sir.
Cytokinesis in case of animal cell furrow formation toward center, and in plant cell you have cell plate away from the center, centrifugal. This is centripetal. Correct. Overall, this mitosis is equational division. If you see, based on the example G1, S, G2, prophase, metaphase, anaphase, telophase, cytokinesis. two major event. G1 example, you have 2n chromosome and 2c DNA. Here chromosome will remain same and DNA double. Remaining thing will remain same. Here, in anaphase, chromosome also become double and DNA was already double. 4n, 4c. And here after cytokinesis, it will divide into two cell, 2n each, 2c each. 2n each, 2c each. Understood? So
Yes, sir.
focus on two things. Anaphase where chromosome double, anaphase chromosome double, and S where DNA double. Only two major changes.
Yes, sir.
Anaphase your chromosome from 2n to 4n, and S phase where you see from 2c to 4c. Done.
Yes,
So
sir.
I think this is where you will face problem ki where chromosome change.
Yes, sir. That's the part I was having difficulty, and I'll use this and I'll solve the questions that I was getting wrong. So,
Sure. Solve question properly.
yes, sir. May I leave the meeting?
Yeah, sure.
Thank you, sir.
Okay. Jordan,
Yes,
how is it going?
going okay. The only thing I'm worried about is tomorrow's test, and like I'm worried
Why?
about physics and physics and chemistry is what I'm worried about because I
Forget
haven't
about
touched it
physics.
at all.
Doesn't matter when you haven't touched anything. Why you're bothered about this? You're bothered
So,
about
Dad,
something.
that is the main reason.
Doesn't
Father
matter.
question.
First you show result in one thing, then touch every. Like you can't do
So,
everything, man.
हाँ वो तो पता है sir, but then he'll be like first he'll be like 330 and then he'll also be like why is your grade not increasing, rank not increasing, and if I don't get
No.
both,
I can
I
talk now, but you show result
he
in
will
one thing.
talk, so he's not believing anymore. He's like, if you sir and all don't attend extra classes sir's taking, only attendance is taking for the this week's test, and after that if you don't do get marks and all, you're not going back to Rohit Sachin's house. You stay in the hostel and sit and study. No need for sir's classes. Just get test scores in this. I don't know
Don't
what to
worry.
tell him,
I,
sir.
I will manage. Don't worry. You just focus on tomorrow biology test. Okay? Done.
Take care, sir.
Come to the point. So movement is a significant feature. All show
हाँ
movement.
sir.
In case of amoeba, protoplasm movement is responsible for the actual movement, simplest form in amoeba. Cilia, flagella, and tentacles are responsible for the movement in many.
Many other things, yes, sir.
When movement lead to the change in the place, it is locomotion. Correct? Like walking, running, climbing, flying, swimming. Locomotion need not to be different from the movement. Example in paramecium. Cilia help in the movement of the food through cytopharynx and locomotion both. In case of paramecium, you have cilia for both food movement and locomotion. Same in
Yes, sir.
Hydra, we use tentacles to capture the prey
Tentacles, yes, sir.
and for locomotion. We human beings use limbs for
Movement.
uh, both body posture change and locomotion. So that's why we can't study them differently. And this statement is very popular. All locomotion are movement, but all movement are
But
not
all
locomotion.
movements, not locomotion, correct.
If I am changing my hand position, this is movement, but not locomotion. For
Yes, sir.
locomotion, I need to change my place.
Displacement should occur.
Hmm. Method of the locomotion performed depend upon the where organism live and what is the demand of the situation. What is the
Yes, sir.
purpose for the locomotion for movement? Food search, living, mating, suitable ground for breeding, good climatic condition. We need good climatic condition. Correct. Cell also show different type of movement. हेलो तुम इतनी देर से क्लास में थी मुझे तो आइडिया भी नहीं था मतलब मुझे लगा तुम आंसर नहीं दे रही हो तो बोल नहीं पा रही थी क्या तुम क्या गर्म है ठीक है, कोई बात नहीं, रेस्ट करो अच्छे से। ये समझ में आया जो हमने पढ़ा था, ब्रीदिंग एंड एक्सचेंज? हाँ, ब्रीदिंग एंड एक्सचेंज समझ में आया अच्छे से? अच्छा, लोकोमोशन में दिक्कत है? ठीक है, तो फिर ये मैं मॉर्निंग में अपलोड कर लूँगा, अभी तो नहीं कर पाऊंगा। और मुझे याद दिला देना, मैं करूंगा पक्का, बस मैं भूल जाता हूँ। ठीक है, याद दिला देना मुझे सुबह। हाँ, क्या? ओके। गुड नाइट। सो जोड़न, example,
Yes,
you
sir.
have question based on this topic. Macrophage and leukocyte in case of blood show amoeboid movement, amoeba kind of movement, like
Yes, sir.
pseudopodia,
Pseudopodia.
and
It's
movement
immune
of the
protoplasm.
protoplasm like in amoeba. You have microfilament cytoskeleton structure in the amoeboid movement because something must be responsible for amoeba like movement in human body in blood cell. Correct. Second,
Yes, sir.
ciliary movement of the cilia present in our body. Correct. Example, in trachea, it helps us to remove dust particle, foreign body. Passage of ovum in female reproductive tract, same
Ciliary
thing.
movement again.
And last is the movement by the
Yes,
muscular
sir.
movement. Muscle will contract effectively, responsible for locomotion and movement both. And it is present in majority of the multicellular organism, right?
Yes, sir.
In locomotion, we need proper muscle. See, this is important. What are the required system for the locomotion? We need muscles, we need skeletal system, and we need neural system. Right? Muscle, bone, and nervous system, all three together. Done. This need not to be done because we are already done from structural organization, right? The
Yes, sir.
muscle is specialized tissue, mesoderm origin. 40 to 50% of body weight is contributed by muscle. Muscle get excited, muscle can contract, muscle can extend, muscle have elasticity. Correct? You have three criteria to classify the muscle. Where muscle is present, what is the look of the muscle, actin, myosin, and how it is regulated, voluntary, involuntary. Like in skeletal muscle, what is the location? Skeletal bone, correct? What is the appearance? Stippled appearance, actin, myosin, dark alternated light and dark band. Regulation, voluntary control, we can control by ourselves,
Yes,
correct?
sir.
Involve in the locomotion. Visceral muscle, what is the location? Inner wall of hollow visceral organ, like alimentary canal. We cannot control the movement of food in intestine or movement of ovum, correct? Appearance, no striation, so that's why smooth, also known as smooth muscle.
Smooth muscles, involuntary.
And regulation, involuntary, involuntary, correct?
Yes, sir.
Last, cardiac muscle, location, heart,
Heart.
assemble in the branching pattern, branching pattern, and based on the appearance, striated, based on the regulation, involuntary. So striated is like skeletal muscle, and involuntary is like smooth muscle. Correct? Why it is involuntary? Because nervous system does not control their activity directly. We have limited nervous system in heart, right?
Nerve nervous system. And then it doesn't redirect also again. Regenerate.
Yes. And this, if you, because in our syllabus we have only skeletal muscle. If we
Hmm.
study the skeletal muscle, each muscle made up of muscle bundle or fascicle.
Muscle bundle, fascicles.
Muscle bundle is also known fascicle. Muscle bundle are attached together with the help of collagenous
Collagenous
connective
connective
tissue.
tissue called
Yes,
fascia.
yes. So muscle bundle have lot of muscle fiber. See, you have big fascicle or muscle bundle. Within the muscle bundle, you have muscle fiber or muscle cell. Correct? You have blood
Yes,
capillary
sir.
and plasma membrane of muscle cell is known as sarcolemma. And muscle bundle are attached with the help of collagenous connective tissue, fascia. The plasma membrane of the muscle bundle is known as sarcolemma. Correct?
Yes,
Muscle
sir.
fiber are syncytium. What is the meaning of syncytium, Jordan?
The multinucleated.
Yes, multinucleated. And they have endoplasmic reticulum in their cell, also known as sarcoplasmic reticulum, is the storehouse of.
Calcium ions.
Hmm. Characteristic feature of the muscle fiber is the parallelly arranged filament known as myofilament or myofiber. Correct.
Yes, sir.
Alternate light and dark band. If we see myofibril study, there is a striated appearance. What is the striated appearance?
It's
Alternate
right
dark
when
and
they're
light.
alternating, like black and white,
Hmm.
black and white again.
So light band contain actin. Also, a light band is also known as I or isotropic band.
Yes, sir.
Dark band is anisotropic
A
band.
band,
A band,
anisotropic.
anisotropic band contain myosin. Both the protein arranged like road-like structure, parallel to each other and parallel to the longitudinal axis, to one another and to the main axis. Correct.
Yes, sir.
Actin filament is thin, myosin is thick. Correct. Myosin is thick filament. If you see in the center of I band, isotropic band, there is elastic
This
fiber
is
known as Z line,
elastic fiber known as Z line.
and it will bisect it, divide into two equal parts. Example, this from here to here,
Hmm.
you have I band. At the center of I band, you have
Z
Z
band.
line. Z line will bisect it. Thin filament are firmly attached to the Z line. Thin filament, actin will
Only
attach
attached
to
to
the
Z
Z line.
line.
If you talk about the thick filament is present in A band. So at the in their middle, there is a membrane known as M line, fibrous membrane, M line, elastic fiber, Z line. And you know A and I band are alternate I, A, I, A, I, A. Correct.
Yeah, keep alternating. Yes, sir.
Between two Z line, you have functional unit of contraction known as
Sarcomere.
sarco means muscle, mere means unit.
Units.
Muscle
It's a
unit
unit of the
which is
muscle.
responsible for contraction.
Contraction. Yes, sir.
If there is resting stage, it means muscle is not contracting.
It's not contracted at all. Yes, sir.
So thin filament on the either side of thick filament is partially overlap, and there will be central gap. This central gap, which is not overlapped,
Hmm.
is known as H zone. This part. See, remember in A band you have both I in A band you have both thin and thick filament, right?
Yes, sir.
But in I band you have only thin filament, no thick. A band contain thin as well as thick both. Correct.
Yes, sir.
In the resting stage, you can see this H zone gap, and the unit between two Z line responsible for the contraction is sarcomere. Correct. Sarcomere.
Yes, sir.
Done. Only one part is left.
Conduction
Yes.
is the part which I hate the most.
But as of now, there was not much issue.
No, sir.
See, uh, this question. Macrophage and leukocyte.
Amoeba movement.
Yes, perfect.
They don't have
Flagellar
phagocytosis,
movement
sir.
will be in the like sperm
Sperm
or
and all.
flagellar movement.
Yes, sir.
Ciliary movement in the trachea and fallopian tube, right? Gliding
Yes,
movement
sir.
between carpal.
Carpals. Yes, sir.
This 174, I will talk to you about the fiber.
So I got to sleep also, so because I have to wake at 5 o'clock tomorrow morning.
So sleep well, leave this.
Okay, so I haven't slept today the whole day.
Don't worry, take proper rest.
So I
And
will fail. I will not get good grades this time. So
no,
you
you will get good grades.